The process of applying the EQUIFACTOR wound treatment is simple, but the protocol of treatment needs to be followed in order to see the maximum benefit. Wear gloves while treating the wound to prevent any contamination from your hands. Keep the EQUIFACTOR wound treatment bottles frozen until they are ready to be used, and do not refreeze once a bottle is removed from the freezer and thawed. Do not thaw by submersing in hot water. Thaw by letting it sit at room temperature or use the body temperature of your hand around the bottle to thaw. Hydro the wound for 5 to 10 minutes until all debris, dead skin, and scab are gone. It is not recommended to hydro the wound for more than 10 minutes. It is normal for the wound to appear red and even bleed a little bit. It is important to hydro the wound with a spray of water that is only slightly fanned out to about a 6-inch diameter stream where it meets the wound when using a hand spray nozzle. After the hydro process is complete, dry the wound with a sterile gauze or clean paper towel in a single pat motion, holding the material onto the wound for several seconds before removing straight off the wound. It is important to not rub the wound, as this will introduce contaminants. After drying the wound with a sterile gauze or clean paper towel, liberally spray the EQUIFACTOR wound treatment onto the wound. After the wound has established a bed of granulation tissue covering the bone, tendon, and muscle, it is important to not continue to wrap the wound. Continuing to wrap the wound will result in proud flesh and will stall the wound healing process. The probability of an infection after the granulation bed has been established is small. It is normal to have some shavings or other material stick to the wound between treatments. These contaminants will be washed off during each treatment. The bottle of EQUIFACTOR wound treatment can be used for up to 3 treatments, depending on the size of the wound. A large wound normally takes an entire bottle for 1 application. If a bottle of EQUIFACTOR wound treatment is going to be used for more than 1 treatment, it must be kept refrigerated. Unfrozen product will be good in the refrigerator for up to 10 days. The wound needs to be treated 3 times a week. A schedule of Monday, Wednesday, and Friday works well. Never treat the wound 2 days in a row. Treating the wound more than 3 times a week may slow the healing process. Treating the wound less than 3 times a week is also not optimal for best results. Please do not hesitate to email any questions about the treatment of a wound to Michael Riddle at riddleinstitute.com.